support service, which is our communications records, our training. However, I'll be moving to our investigative services bureau, where I'll be in.
William, you're coming in a little bit.
Yeah, we missed what you said. You're coming in and
out. But welcome, Wade. We're glad to have you. Glad to have you on board. Forward to working with you. Okay, and then you said someone else would join in just a bit. Maybe we can, at the end, we can maybe introduce there. Does that work?
Yes.
Okay.
For those of you on the phone, I am going to go ahead and mute everybody because we're having some listening issues. So if you need to unmute, just realize that you will need to do that from your end.
Okay. Can you hear me okay, Kathleen?
Yes.
Okay. All right. Well, why don't we, hopefully everybody's had a chance to read the minutes from the last meeting. I thought they looked pretty good. I'll just, I guess, make a motion like I did last time that we approve those minutes as they're written. If somebody does have feedback, please let us know, but I'll make the motion if I could get a second.
I'll second it.
All right, thank you. Any opposed? Okay, well, thank you for that. All right, well, we'll move to the first real topic then on the agenda. And Andrea, I guess you're up. There was an FRM discussion that you had wanted to lead, so I'll turn it to you.
So Kathleen, if you can give me I can show my screen. Thank you.
Andrea, are you still there?
I'm here. Okay. Hopefully you can now see my screen.
Not yet.
No, you cannot see my screen. It says I'm sharing it.
Well, I can see it on at the bottom of my page here.
Okay. The fair market rent. So it's not the most elaborate thing. It's really just an Excel spreadsheet showing the fair market rents over the last 2 years. So one of the challenges that we're seeing across all of our housing programs supporting people moving from homelessness into housing is the challenge of finding apartments that they can rent. So this affects all of our rapid rehousing programs and all of our permanent supportive housing programs where tenants are not allowed to lease units that are more than a fair market rent in our community. And a fair market rent rate is actually set by HUD on an annual basis. So if you can see the chart, it will help you, but I'll talk through it. So in 2021, the fair market rate for a studio apartment was $624. In 2022, there was not much change, but it went down from 624 to 623. And what we see going up from the bedroom sizes is an increasing drop in the fair market rent. So for a one bedroom, there was a 1% drop from 670 to 664. For 2 bedrooms, it went from 825 to 808, which is a 2% drop. For 3 bedrooms, it went from $1,111 to $1,075, which is a 3% drop. And for 4 bedrooms, had the biggest drop at 6% from $1,322 to $1,249. So the challenge in 2021, we were challenged to find apartments. The other thing I have up here is in 2021. I don't have the 2022 data, but the 2021 data shows we had an average rent in our community of $1,025 for a 917 square foot apartment. And the data didn't break it down any further than that. But what you can see, like our average rent is more than the 1 and 2 bedroom fair market rents. It's just a little bit more than the 3 bedroom rents. And with most of the folks that we're helping being chronically homeless single adults, they are looking in that range of either studio or 1 bedroom apartments. We are struggling to find apartments that meet those fair market rents, let alone also pass inspection and or take a subsidy. So one of the challenges we're seeing is as the fair market rents go, the other thing that we're seeing in the market, particularly as evictions are happening, is that landlords are coming back. They're not reducing their rent. So while at every size, fair market rate went down, even though it sounds like a little bit of 1 or 2%, rents aren't going down, they're going up. Which makes that gap between what's available on the market for people to choose from is ever decreasing. So we're seeing a huge decrease in the supply of housing that folks exiting homelessness in supportive housing programs can access. So that's a huge challenge for all of the goals we have for the continuum of care, because the programs that we have require the use of fair market rent as the marker for what people can pay. As we don't have those units in our market, we're not able to move folks out of homelessness. So I just wanted to put that data in front of folks. Maybe have some discussion about strategies that we see we could work with to try and address some of the disparities that we're seeing between what's available and what we can access.
Andrea, just a curiosity question. Any idea what was behind the decrease when the actual rents are not decreasing but going up?
Shrika, I don't know. I really don't understand HUD's formula creation plan. I don't know, Shrika, if you have any insight into how HUD comes up with these numbers.
I don't. I know we were expecting an increase. We were excited for the new FMRs to come out because we were thinking they would be higher than previous years, but unfortunately they weren't. So I know Andrea did mention that there is possibly a way we can reach out to HUD and see about them looking at them again. So I think that's where we are right now.
Yeah, I think I would do that. I'm just not sure how they came to that conclusion.
And it seems that HUD is just out of touch with the reality of the market. And that seems odd for a HUD to be like that.
Yeah.
Yeah. I will. So I would like reach out to HUD and talk with them about ways to appeal this setting for us. And with your blessing, I'll go ahead and do that. So go ahead, Shane.
I just think, do we need the motion that? Because if we do, I will. If not, just, go.
Yeah, I think it would be great if we had a motion just so that when I go to HUD, I can say that, like, this is our commission is concerned about this, and I'm speaking on your behalf as opposed to just me.
And then I formally make the motion for Andrea to go and make an appeal to HUD to change those numbers.
Okay.
And second.
Okay. Any opposed? Okay, thank you. Anything more on this, Andrea?
I think the only other thing, not necessarily for today, but we'll put it on future agendas, but for you to be cogitating that plays into this problem is the supply of housing in general. And what our community is seeing as affordable housing rates. So right now in the conversation, folks, when I say the city, I mean in Winston-Salem in general, not necessarily city staff, but Winston-Salem in the conversation in the community is looking at $1,200 as an affordable rent. And that is simply unaffordable to teachers, police officers, people who are working in the hospitals, people who are working in restaurants, people who are working in any of our service industries. And so I think it's important for us as a commission to wrestle with how do we engage in that conversation of what does affordable mean, particularly because the population we're trying to serve aren't even making as much as teachers and police officers and firemen, right? So they're living, instead of, $35,000, $40,000 a year, they're making $9,000, $10,000 a year at most. Some of our folks are below even that. Our folks on disability are at $674 a month. So they just simply can't afford what the conversation is in the community as being affordable. And that's where we're looking at the development of new housing in our community, and we're seeing any market in housing that is affordable to people at or below median income being even in their reach. So we will put that on future agendas, but just to, as time goes over the next few months, think about like the businesses you're connected to and what the wage scale is in your industries and how that compares to the market that we have in our community.
So Andrew, isn't there a special commission for affordable housing that's been
There
formed?
there is an affordable housing commission, and they are looking at issues around affordable housing. I think it's important for us to also weigh in on it because we have for folks exiting homelessness, probably about half of them really are struggling with straight up affordability issues. We have folks that are struggling with additional issues in the homeless population in terms of this interplay between fair market rents and access to affordable housing. But just the sheer supply of housing at this point is causing a problem.
Would it be worth having someone from that affordable housing commission come and maybe give us an update on kind of what's happening there?
I think that's a great idea. We can arrange that for hopefully the January or February meeting, depending on their schedule.
And then based on that, we could either give feedback in the meeting, right, or think about back with some thoughts. Okay.
So that's all I have for this.
Okay. All right. We will shift to a different topic then. And Laura, I'll go to you. We had on the agenda an update on mental health, the mental health work group. Laura, are you there?
Can you hear me?
Yep.
Yep, heard you now. Yep.
Sorry, I was talking. I was muted. Yes, I prepared some slides. So Kathleen, if I could have the ability to share my screen, that would be great. I am not here in my usual capacity. I'm usually here to report on some data that is going to be submitted to HUD. This is a very different role for me. A few months ago, Andrea asked COC members to split up into work groups, and one of them was about mental health issues that are, being witnessed by providers. And I joined that. I volunteered to join that work group, and so I, worked with the mental health work group for several weeks, and it was me and several other people who provide services and directly to people who are homeless in our community. So I basically just took notes. So I'm here to just provide a summary of what the work group identified as being the main issues, the main problems that they are witnessing, and the solutions that they sort of brainstormed together. Okay. All right. So the work group's goal was just to identify the main issues that they have been witnessing related to people who are struggling with mental illness and homelessness at the same time. We tried to think about potential solutions that are currently not available, and we are going to be providing a more fleshed out presentation for the COC, for the executive committee of the COC to review. So this is just a summary. And the work group was composed of several people from the street outreach team, shelter workers, a few case managers, and a few executive directors from several agencies in the community, and myself. So I'm not going to take too much time, but I wanted to review the main issues that kept coming up during the discussion. So first of all, a general lack of access to mental health services. As you already know, many of the people who are homeless and currently being served by homeless service agencies do not have insurance and do not have the money that it would take to pay for services out of pocket. Also, many of them do not have their own transportation, and assessing transportation to and from their appointments is often just very difficult to manage, and people are not able to keep their appointments. Also, childcare is a huge issue. People are not able to attain the childcare that they would need in order to, get to their appointments to receive the healthcare services that they need. Many of the programs that are available in the community have criteria that people struggle to meet. So things like being compliant with various rules for the program, taking all of the medications that they have been prescribed on their schedule was repeatedly mentioned by members of the work group. People really struggle to stay on their schedule, and many of the services that are available will not provide mental health services if the person is not taking all their medication. Also, many of the services cannot consistently serve people who are experiencing acute emergencies where they are. So we recorded many, during our discussions, instances of people, somebody calling for the assistance and then the assistance taking quite a bit of time to get to the person who is in need. And then once the person is assessed, maybe the person's symptoms maybe are not meeting the criteria that would allow the current services that are available to actually serve the person, right? So there just seems to be many gaps in the spectrum of mental illness that are present and leave people unserved where they are. Another factor that was repeatedly mentioned is that oftentimes people who are homeless have had negative interactions with healthcare providers in the past, and that the service that is often provided currently is not necessarily trauma informed. So oftentimes people can be alienated from the services that are being provided, or the lack of control or information or education that is being offered makes people hesitant. So that had to do a lot with the general tone of the services that are being provided. There was also a lot of discussion about wraparound services provided or available to people who are housed. So once somebody is housed, because of all the issues we've already listed, it can be difficult for people to access the mental health services they need, and it can lead to people losing the housing that they've worked so hard to achieve with their case manager. And then lastly, we had several conversations about the gaps in services for people who have multiple health problems at once. So I've listed here people. It's very common for somebody to have both a mental health condition and substance abuse, or a mental health condition and a physical health condition. And oftentimes in the mental health providers that are available in the community right now, there may not be staff people who can, for instance, stabilize somebody's untreated diabetes along with their mental health problems. Right, so that can often lead to this gap where people who are dealing with multiple health problems at once are being underserved, and that was mentioned multiple times throughout our meeting. So then we talked about possible solutions, right? So we sort of tried to push ourselves to dream up in a perfect world style solutions, right, so that we can identify what the real solution could be. So the first thing people mentioned is we really need help getting people on the benefits that they should be on. So here you'll see both assistance for applying to Medicare, Medicaid, and then also down below, SOAR workers that can help people apply for the disability benefits that they qualify for. So in case anybody is not familiar with what a SOAR worker is, I can't remember what the acronym stands for, but a SOAR worker is somebody who would work full-time, working with people and helping them with the application for disability benefits, because that is quite a mountain of work from what I understand. And then we also discussed the need for meeting people where they are. So we talked about childcare and transportation issues. It's really difficult for people to get to the services they need. And ideally, it would be wonderful for people to be able to get services where they are. So for our unsheltered population, which is growing, it would be wonderful for them to get robust mental health care in the place that they are camping potentially, or in our shelters, or at a soup kitchen that they're working on. We have day centers in the community, and they offer another location where services could be provided, and it would be much easier and much more accessible because people are often already there getting other services. Lowering barriers so that homeless people are more likely to be able to get served, pretty straightforward there. And then the final one is basically mental health services that are specifically designed with the average homeless patient in mind, right? So it seems like a lot of the services that are currently available in the community are low barrier, but not low enough, right? And because of the special needs of people who are homeless, it may require some from the ground up design, right, specifically for that population. And so some final recommendations from the work group are to, I know that there is a new organization in partners, right? And so we would like to know what programs Partners is going to be bringing to the community. A lot of the folks who were in the work group, we also brought in some guests who just came for one session to be sort of interviewed. A lot of conversation about the HOT project, which was definitely from before I was here, but people kept on bringing up the HOT project as being a great project that met people where they were and provided services in a way that is still very much needed. So one of the recommendations from the work group is to review the HOT project and consider whether it can be relaunched. find ways to create new mental health services that are specifically designed for the homeless population, and lastly, bring on store workers so that people can get robust assistance applying for disability.
Does anyone know what the HOT project was?
I can describe it based on what I learned from the work group members, but if anybody was here when it was happening, I'd love to just let somebody else describe it.
Yeah, I mean, I was part of the crew that put that project together, so it was really actually driven by the Department of Psychiatry at Baptist, and was a partnership between Baptist and Samaritan, where Baptist had a psychiatrist and psychologist and then therapist who were placed at the soup kitchen to provide drop-in access to psychiatric care. So one of the challenges folks have accessing mental health is when they're on the streets, when they have complicated mental health challenges, getting to appointments is challenging. And this allowed people to, when they were getting their lunch, they could drop in for services. They could set appointments as if they missed their appointments. They could have their appointment whenever they showed up. So it was really meeting people on the street where they were at. And we saw a huge decrease in the number of folks on the street with severe psychiatric illnesses when that project was up and running. They didn't necessarily come off the street, but their psychiatric illnesses got stabilized so that then our housing programs could better work with them and move them into housing. It was a really good partnership.
Was that done as an experiment? Sounds like it went well. I'm curious why it ended.
So I can't speak so much to why it stopped, except I think it had a lot to do with money. And the people who were running the project left the community. But it was incredibly successful. So
I'm out of the mental health world now, but I used to live there. And so Daymark is our provider in Forsyth County. And I was on the committee that was looking at the transition between Cardinal to Partners. And one of the challenges with Cardinal over the years has been the lack of responsiveness of the mobile crisis unit, which is run by Daymark. And the mobile crisis unit is the unit that's designed to meet people in the field with exactly what you're talking to do. And it is funded. It's a funded unit. So we are hopeful that Partners can put the pressure on Daymark to make that service more accessible, because that's what it's designed to do. And it is a funded project.
Yeah. And I think the difference between mobile crisis and the HOT project, and mobile crisis is an incredibly important service, is the HOT project specifically targeted folks that are chronically homeless on the streets. And some of the, there are many challenges with accessing mobile crisis. One of the challenges we've seen with folks who are sort of severe and persistent mental illness on the streets is mobile crisis doesn't see them having a crisis. They see them as having this is their norm. So they don't respond when we have them.
And those were a lot of the conversations that happened, and some reasons we chose to try to move away from partner.
Yeah.
So it sounded like, if I heard you correctly, Andrea, that the folks who had been leading that effort are no longer here. And so maybe so I don't know that we could just simply go back to how we started it before, but it might be worth thinking about if we wanted to relaunch something like that. How would we get started with it?
Yeah, I think we'd need to start with the, possibly the hospitals, possibly Daymark, about whether or not they'd be willing to, or Partners even, about investing in sort of a site-based clinic. I think part of the magic of the HOT project, it was connected to the soup kitchen. So I mean, generally everybody knows if you have food, it attracts people. So people would come to get food, and they could, and then it was very easy to say, and you could meet the doctor.
Mm-hmm. Okay. Laura, anything else? That was a good update. Anything else, Laura?
No, like I said, this is just a summary. I'm going to be sending all of the notes to the executive committee of the COC. And I'm sure that, you know, if y'all have any questions, I can definitely either try to answer them now or come back after I discuss it with the other work group members. Thank you.
Okay. Any other questions for Laura on this topic before we change topics? Okay. Well, we want to come back to a topic we talked about last meeting. We talked about it a few times. It's the encampment policy. And when you read the minutes, you saw we had tabled that approval until this meeting to give some time for some additional stakeholder vetting. And Andrea, I'll let you give an update on kind of how that process worked and what's been done. So I'll just turn it to you and let you kind of give an update, and then we'll look to see if we can get approval for that policy.
Okay. So we, between the last meeting and this meeting, we held 3 open comment period sessions. I ran 2 of them. Kathleen ran 1 of them. We held them at various times during the day, and they were all virtual. We sent the link and the information out to the entire continuum of care mailing list, which is very, very broad. Pretty much just everybody's email address we've ever had, and encourage folks to share that information among stakeholders. And we reached out to other stakeholders that were involved in the breaking down of the Akron camp to make sure that they were aware of this. So of the 3 sessions, the first session we had no one attend. The second session that Kathleen ran, there was a handful of people that came, and then the last session was yesterday, and I had 1 person come. And in general, folks thought the policy was a really strong policy. The comment I got yesterday was from a street outreach worker who was concerned that by having street outreach staff at the site when it was being broken down would jeopardize relationships with folks that they spent a lot of time building. So I said that I would pass those comments along. And then Kathleen, I don't know, aside from the sort of general support for the policy, if you had any other comments that people wanted passed along.
Kathleen, you still there? We may have lost her. So I guess my thought on this is I will not be surprised if at some point, Kathleen,
sorry.
now?
Yeah, I had 3 people attend the session that I ran, and they were all supportive of the document as it was written, and didn't really have much else to add to the conversation. They were fine and thought that it was well written and supported it.
Right. So my interpretation of this policy, and Andrew, you guys tell me if you see it differently, but this is really meant just to be a guide for how we would try to deal with these encampments. And so it's a starting place. I would not be surprised if over time it gets refined, and it probably should be the expectation as stakeholders, do more of these things. We'll learn, and then we can adjust the policy as we go forward. So I think it's well written. I think we've given opportunity. You guys have done a great job trying to make sure we're giving opportunity to all the stakeholders to, voice any concerns that they have. And so I think we're probably at a point where we can ask for approval and just recognize it's a living document, and it's going to change over time probably.
has the potential to anyway. Any questions on the approach if we were to approve this today? Any concerns the group has with the process to this point?
I actually have a concern. Naturally, I'm paying attention to the police department's role in this, and I read where their role will be to complete health and safety inspections, and I saw the form. One of the things to recognize about the police department, and I can't speak for the sheriff's office, they're not going to complete a health and safety inspection unless only superficially, unless they've been trained to do so. And our public safety attorney wouldn't be in favor of us filling out a form that she hasn't been through or that we haven't been trained to fill out.
So, William, I can answer. The form was included as an example. It doesn't have to be used, and we could take that out of the policy so there's no confusion that it was included just as an example. And the intent is, and I think the police department does this now, that people couldn't just randomly come up and say, this site has to be closed. We're only going to close it if an official body says there's a health concern or a safety concern. And typically the police department is saying there's a safety concern. And that's what led to the closing of the Akron camp. And then the conversations I had with street outreach worker yesterday, there's been a number of camps closed in the last couple of months because the police said there are safety concerns. So the intent wasn't to create forms, but the intent was to say only these officials can close it for these reasons. Does that make sense?
Okay, it does make sense, and naturally that everyone's health and safety will be at the forefront of any decision we make on that. So everything else read well to me.
Okay.
So is there a recommended maybe edit for that section that I'm hearing, or did that answer sort of get you comfortable? I think that was William.
Yeah. William, if we took out the example from the policy, would that help clarify, you think?
It would, and it also temper expectations a little bit, I think, if that was edited out.
Okay. So maybe then the motion would be to approve the policy with that edit, right? To remove that example and to temper that language in that section. And William, you can help, with the language you're comfortable with for that piece. So maybe it's with that in mind that we could that I can make that motion. If I could ask for a second. Let's see, Robert. Okay.
When we set this policy, we need to make sure that if somebody goes outside of this policy and wipes an encampment, they see charges brought. Because that's one of the big things that this would serve, and it would also reflect back to street outreach being present there. If street outreach is present during an encampment being removed, basically they should be there with the stance of, okay, we're going to make sure that people's property gets saved and not just thrown out. It should be clear that if you wipe an encampment outside of this policy, you will get prosecuted.
So, Robert, I very much appreciate your comments. Just so everyone's clear, the policy is a policy of the COC, and we don't have the authority to make anything a crime. But we can, right? So if the COC is asked to participate, which is what led to this policy when we were asked to participate at Akron, there was no guidance about when we would participate or how we would help participate in closing an encampment. And so certainly if there was, if is seeking our assistance in closing an encampment outside this policy, we will say no. But we don't have the authority to make it a crime, whether we want to or not.
Right.
So.
Okay. So I was misunderstanding, Rob. I saw you were raising your hand. I thought you were seconding, but was there a second to approve?
This is Shane. I'll second.
Thank you, Shane. Any opposition? All right. Well, we will consider that approved. With that one caveat, thank you, William, for raising your thoughts there. And we will keep moving. So let's move to the next topic here. Andrea, I'm sticking with you here. Emergency placement vouchers. I think you wanted to talk through that.
Yes. So this is just for clarity, this is separate from what Jessica's going to talk about, which are emergency housing vouchers. But we, in partnership with the city and Shrika, we worked out a plan for overflow solutions for families. So typically in the winter, when we run overflow, we can only serve single individuals because the plan that we have works with using church space to house overflow folks. And we can't house children in churches overnight for the purposes of overflow. That's a different conversation. But we have some extra money from the CARES Act funds that we weren't able to spend doing prevention. So we've shifted them to be used to create vouchers for emergency placements for folks. If the family shelters don't have any space, we will transition folks to an emergency placement. That emergency placement could be our assisting them in sort of mending bridges with where they were, so they can go back and buy them some time to find a more permanent solution. And as a last resort, we have vouchers where we can place people in hotels. So currently we have served about 7 households in the last month with these vouchers. If we keep up the pacing that we have, we'll be able to get through the whole winter. If it accelerates more than what we've seen, we may run out of money, but we're monitoring that very closely right now. So the intent really is, if families are seeking shelter, we will provide an emergency placement for them. But we're not, the fine line that we're walking is, if families have a safe place to stay, we're not necessarily going to put them in a placement, an emergency placement outside of that safe place just to get them into the emergency placement.
So Andrew, if we have a limited reserve at this point, and we're heading into the winter, how concerned are you? We will run out here?
Right now, I'm not concerned. I will have more information for you when we come in January. I think, part of my concern was when we first opened it that we would have 10, 15 a week, but we're really seeing just a couple a week come in. I think the shelters are all doing a really good job at what we call diversion, which is when families are coming in, trying to sort of preserve whatever housing option they had, as long as it's safe, preserve that before referring them for an emergency placement. So we're really only taking folks into emergency placement that have nowhere else to go. So I'm hopeful we'll make it through the winter. The one thing to sort of, for the commission to be mindful of is these are CARES funds. So it's, unless we find additional revenue sources, it's not replicable next winter.
Okay.
Because it's not a recurring funding source.
Okay.
And just to add to what Andrea said, the goal is to last, when the city did the budget and mapped out the program, our goal is to go at least to March. That's the goal.
Okay. All right. Anything else, Andrea? I know we got a sort of a similar topic next with Jessica and the emergency housing voucher.
But anything else on the emergency placement? Okay.
That's
All right.
I
Well, we
got.
can shift. We can shift then to you, Jessica, and maybe talk about the emergency housing voucher.
Yeah, this is just an update to let you guys know where we're at with them. And just a reminder, the Housing Authority was allocated 31 vouchers that were made available through the American Rescue Plan Act. And we were figuring out the logistics of it back in June, July. And we as a COC agreed to prioritize them to literal homeless families with young children aged 10 or below. All of the vouchers were allocated in mid-August. As of 3 weeks ago, the update that I received was that 20 of those 31 vouchers have officially been processed, which means the paperwork was submitted to HAWS, the voucher has been issued, and the household is looking for housing. Only 5 of those households so far have identified housing and moved into housing. So there's a good 15 that are looking for housing right now. And then the other 11 that were allocated, there's a couple that are still pending, hoping to get documentation in. And some of that is an inability to get social security cards and IDs. And some of them did not engage in the process, so we had to reallocate. So a couple of them are just starting the process. But that is where we are with emergency housing vouchers. So I just wanted to keep you guys in the loop. And if anybody have any questions.
Any questions for Jessica? Appreciate that update, Jessica.
No problem.
So I've got one more item here on our agenda, and then we'll see if there's anything else. But it was a CWD final report on overflow. I'm showing Ruth and Russ as reporting here. So I'll turn it to you guys.
Yeah, Andrea, do you want me just to jump right in? No.
Yep, go ahead.
Sure. So thanks for having me. Ruth is in a training right now, so I'm just kind of speaking on behalf of Citywide Dwellings as best as I can. We are preparing to open 2 different responses to winter shelter needs. The first, which will open on December 15th, is an everyday, starting on on December 15th. It's open every day until at least March 15th. I'll say more about the at least part here in a second. But it's open every day, and there are 2 sites for this daily open winter site or winter shelter. One of them is at St. Timothy's Episcopal, and it will handle women guests. And the other is at Augsburg Lutheran. It will handle our male guests. And the intent of this site is kind of covering 2 things. One is certainly overflow, as the other shelters are full and people are seeking shelter. We're trying to accommodate that overflow need. But we're trying to prioritize and be proactive on working with folks who are currently on the street, even without trying to access the other shelters, trying to help them to enter into a shelter space during the winter. Because we know this is just dangerous times when it gets brutally cold for folks with severe physical health challenges to survive that time well. So we've been working with them and trying to go ahead and prepare them for entering into that space if they're on the street right now. We anticipate, so that's 2 sites. Each site by code are limited to 20 persons. And so that's 40 persons that we'll be able to handle in those 2 sites. We don't believe that's a real problem, that number, because a lot of the folks who are on the street do kind of ride it out even in the winter. And so we're believing that those 40 spots, along with a strong diversion team ready to meet folks at the front door and help them to make other plans if they have other resources or networks or whatever, that we'll be able to handle whoever shows up, that we won't have to turn anyone away without a plan for them. At the same time, on December 15th, we will also make available, when the weather calls for it, white flag shelters. What a white flag is it is only open like when it's 32 degrees or below, or when it's 38 with precipitation. This site will be at New Story Methodist Church off of Peters Creek. And again, we do have different kind of limitations with capacity. It's more just the facility limits. So we'll probably only handle about 25 people, but based on last year, that seems to be sufficient for that too. And like I said, the diversion team will be running every single day during that time to try to help folks find other resources. I had mentioned that March 15th was a possible last date. Thanks to a lot of fundraising that went on, and a big thanks to Sharika, who shepherded some resources coming out of the city. We actually think we'll be able to stay open till March 31st, but we just don't want to lock that in just yet. So we're going to treat that conditionally. So based on the resources that are available, based on the number of people still needing shelter at that time, and then based on the weather, we'll try to stay open the last 2 weeks if possible. But it looks like we will be able to. And that's the plan right now. I can certainly answer any questions, but just in the broad strokes, that's what we've got going on over here at City with Dwellings.
Okay. Thank you for that, Russ. Any question for Russ? Okay. Well, Andrea, I think that's everything we had on the agenda for today. I'm not sure if there was any other topics from you or anyone else that we wanted to touch on.
I don't have anything else. I will point out, Michael Weissman has joined us. He's our other new commission member.
Okay, great. Well, welcome, Michael.
Hey, y'all. Sorry about that. We were kind of going through some. I work for Lowe's Foods. We're trying to open up a new store, having some challenges, we should say, in January. So I had a meeting today about that I could not get off of. So sorry I missed part of this, but Andrea would love to catch up with you about what I missed today, getting up to speed. So thanks.
Yep.
All right. Look forward to working with you. All right. Well, that is everything we had on our agenda for today. Appreciate the conversation and the presenters covering the topics. So hope you all have a good rest of the day, and we'll get our meeting on the calendar for January and February here soon, and then set the rest of the year. So stay tuned for those meeting dates. All right.
You as well. Take care, everyone. Thank you so much.
Thank you.
Bye.